Welcome to the Wellness Lab, where science meets self-care. I'm Ben Ragone, and I'm a psychology student at the University of Toronto. Today I'm joined by Shannen Kyte, clinical neuroscience student and mental health researcher at the University of Toronto and Centre for Addiction and Mental Health. During today's episode, we discuss the current state and trajectory of digital interventions in mental health care. Shannen offers insight into his relevant research and how it relates to recent findings, trends, and skepticisms in this field. So, if you're looking to learn more about modern mental health care and some of the innovative technologies involved, this is the episode for you. Shannen Kyte, welcome to the Wellness Lab. Happy to have you.
Thank you very much. Happy to be here.
I just want to kick off today's episode by introducing you and some of your work. So, for listeners who might be unfamiliar with some of the things you've done, could you tell them about yourself and explain your connection to today's topic, digital mental health interventions?
Yeah, for sure. My name is Shannen Kyte. I am a master's student at the Institute of Medical Science at University of Toronto, transitioning to a PhD soon. So yeah, please prayers for that, everyone. Yeah, essentially my research focuses on schizophrenia and addictions populations. There was this class that I took in the first year of my master's where we had to come up with a topic for systematic review and meta-analysis. And so, I started digging and I stumbled upon a virtual reality for auditory hallucinations in schizophrenia. So that's something that really captured my attention, instantaneously. I was completely enamored by the topic. And so, I started doing a paper on that. And then now my work focuses more on addictions, and there's this study that I'm going to be more involved in soon. It's using the Aura Ring. So for listeners, I guess the Aura Ring is essentially something that tracks heart rate, activity, temperature, blood pressure, things like that. And so I'm going to be more involved with a study that uses sort of physiological measures and ecological momentary assessments. So that's another thing, kind of tracking moment to moment or like changes in different things, different kind of measures throughout the day or throughout the week. So yeah, I guess in terms of research, that's my connection to digital mental health. And I'm just very passionate about learning in general about digital mental health because I think where the field is going in the future.
Yeah. And then I just want to take us back a step here. So that paper you said you worked on throughout your master's. So I do just want to congratulate you again. That
Thank you.
paper has recently been published. So for our listeners, I'll put a quick link to that in the description if you want to go check it out. But just for a bit of context, in the study, as you said, VR manuscripts were being used for schizophrenia treatment. Can you go into what the work with that article was a bit more?
Yeah, for sure. So I think just some kind of background. I think when people think about like whenever I've presented this topic on VR for auditory hallucinations in schizophrenia, I think the first thing that happens is people are like, that's sort of insane because to give listeners kind of an idea, essentially schizophrenia has something called active psychosis. Usually most patients with schizophrenia have this sort of active psychosis at some point. It's where they have hallucinations, delusions, and all of these things that are not sort of grounded in reality, but that patients with schizophrenia believe are happening. And so on top of active psychosis or having phased active psychosis at some point, when I've mentioned VR, it's to, audiences instantly they're like, oh, that's sort of insane because VR also has this sort of augmented, virtual sort of reality that's created. And so, how does that go hand in hand? Well, I got to learn more through this specific project that I was working on. Essentially, most interventions in VR for auditory hallucinations specifically, so auditory hallucinations when you're hearing something that isn't actually present. So usually it's voices, like predominantly it's voices. And so how virtual reality is used is through this therapy called avatar therapy. Essentially, patients are asked to create an avatar of the face behind their voice. And most people actually have a visual image of the face behind the voice. When they don't, they're asked to sort of think what the face would look like. Essentially, they kind of create this avatar, right? Facial features, modifying them specifically to what they think the face behind the voice looks like, or what they know, what they know the face behind the voice looks like. And then um, the voice characteristics are also adjusted. So things like tone, stuff like that, loudness. So all of these things are adjusted. And then you have an avatar that basically speaks and looks like their voice. And so what happens next is there's usually a therapist involved in this avatar therapy, and the therapist voices the avatar and engages in a dialogue with the patient. But the therapist also plays the role of the therapist in helping guide the patient sort of through that conversation. And essentially, the evidence kind of shows that when patients have a better relationship with their voices, or they have sort of non-threatening, because usually voices are sort of threatening and derogatory. I feel like I should have mentioned that earlier, but yeah, it has a significant impact on their life. But when they're able to have a better relationship with their voices, the symptoms overall seem to improve and actually reduce. So auditory hallucination severity seems to decrease, the distress associated with it seems to decrease, and the frequency even of voices seem to decrease. And what my paper found was, of course, like immediately after the intervention as well, but also at follow-up time points of up to sort of 1 year, that we see these sustained effects. And I think, this is powerful, and this is for people often with treatment resistant auditory hallucinations. So, antipsychotics and other medications haven't worked, and then they've done this sort of VR or avatar therapy treatment, and it seems to have beneficial effects for them.
That lasting effect, I think, is so impactful because as you were
Mhm.
explaining this, my brain instantly went to, well, you don't want a patient to, spend all day in the VR thing to not to as the like a coping method or whatever. But the
Yeah.
fact that it lasts so long is so impressive to me. I'm curious, what's the science behind that improvement of symptoms? Like what do patients describe? Is it an increase of comfort, safety?
I think it's just sort of being able to deal with the voices better, essentially having that less sort of aggressive relationship with the voices. Again, there's a couple of theories, right? So one theory could be that, and I think that this is probably the most important one, that they seem to have a better relationship with the voices, less aggressive, more sort of amicable, more kind of living in harmony, essentially. We see this in conditions like, dissociative identity disorder, or split personality, where you kind of live in harmony with your multiple personalities. It's similar in this case, but also the voices seem to decrease after that harmony is created, oftentimes, right? And so that's one thing. Another thing could be the sort of immersion that VR offers and the controlled environment, which allows them to sort of focus on just the voice and deal with it better, because they have the voices anyways. And I'm sure, decent amount of patients try to have a good relationship with their voices outside of VR. But what seems to help is within VR, in this controlled setting, when they're taught how to sort of deal with it better, also seeing a visual representation. So of course, visual hallucinations are possible, but oftentimes it's just auditory hallucinations. They don't necessarily see the voice, but it's the voice that's constantly sort of threatening them, and they hear it, but then kind of confronting it face to face is also seems to have an impactful change.
And then I also want to ask if since this is such a new thing, VR is already
Mhm.
such a new technology as it is, and then
Mhm.
using the, using it in this medium is also a very modern idea. Is
Yeah.
there something that you wish people knew about digital mental health care interventions that a lot of people might not have considered, might not be aware of?
I think it's well, it's like I said at the beginning of the recording, it's the future of it's the future of mental health, and yet there is a lot that we don't know about it. I think the important thing that researchers have a sort of responsibility to right now is to sort of just keep testing these therapies and keep seeing if they're effective. So there's a lot that's in the works. There's a lot that's still being tested. There's a lot of apps that are still being tried and tested to see if they're effective. Yeah, I don't know if that exactly answers your
Mhm.
question.
I'm going to break this question into two parts. So
Hmm.
since this is, we're calling it the future of mental health care, what's
Right,
the benefit in terms of the patient? And then what's
right,
the benefit for the clinician? And
yeah.
specifically, what benefit is there with digital mental health care that a physical treatment might not offer?
Hmm. Yeah, no, Well, that's a loaded question or questions in the sense that, yeah, there's a lot to unpack there. So I guess let's start with patients first, right?
Hmm.
I think for patients, it's important to recognize and see. A lot of people are going to say this ties into the point about physical versus, virtual as well. A lot of people are going to say that, hey, a lot of clinicians, a lot of people in general would prefer having physical treatment, and that's fine. I am all for sort of physical therapy and physical treatment, not physical therapy, but in-person therapy and in-person treatment. When that cannot happen, unfortunately, due to cost, due to accessibility, right? There's a lot of people who live far away from these mental health hospitals, right? The biggest one in Canada, for example, is the Center for Addiction and Mental Health, where you get the best help. There are other places as well, like Ontario Shores, for example, or Lake Ridge has Lake Ridge, Ajax Pickering Lake Ridge has a partnership with CAMH. But what happens when you're living so far away, right? And so that accessibility piece. There's a lot of people who cannot travel because of busy schedules. So I think accessibility and also cost, right? There's a lot of people who cannot afford, clinical psychology sort of counseling sessions because they're very expensive. A lot of things are not covered by medical insurance. And so all of these things play a huge role uh, in terms of other aspects. I think it's important to recognize that in-person therapies might be great for a lot of people, for sure. I would argue for a decent amount, for whatever reason. It's again dependent upon the condition, but say, anxiety or the fear of being in public spaces. A lot of these individuals, they might find it difficult and overwhelming to do in person as the starting point, right? And so digital interventions can be used as this sort of starting point where they begin with something digital or virtual which is also in a very controlled environment, to become more comfortable, and then they transition to in-person therapies. So that's more on the patient side. I think in terms of effectiveness, we're seeing that it's has comparable effectiveness to virtual therapies. But then now speaking more about the clinician side, if no one's aware of this, I have to bring this out, but there is an enormous clinician burden. And of course, like I have been, a patient in the emergency in hospitals, right? I've had an appendicitis surgery and this and that. So I have been a patient as well. Again, it's not mental health, but I have been a patient as well. And I know that it's excruciating being in those situations. Like it's really painful having to wait for 6 hours or 10 hours waiting to get a turn and waiting to get treated for something severe. And that includes mental health, because for mental health there's a backlog of months, right? But I also sympathize, having seen the other side of it, that there seems to be a lot of physician burden as well. There's so few clinicians to treat so many patients, right? And so, I sympathize with that side of things as well. One thing that, very much can be used to resolve this is having digital interventions, something that, especially things that can be, of course, run virtually to a certain extent, that would save time. Some would argue that if a therapist is involved, it would really not resolve much. But there's a lot of therapies that can be run, with sort of minimal therapist interaction, or even by patients by themselves, right? A lot of apps, a lot of, we're starting to move towards some level of brain stimulation that can be done by patients themselves without too much therapist intervention. Things like that. It can be done for patients at their own time. And so that just, you can imagine, that reduces the amount of sort of therapists or clinicians needed to actually treat patients. So, yeah.
This is a field that's gone through a lot of development in the last few years. There's been a ton of research, as you've said, in figuring out different new treatments which are effective, how to revise them so that they're as effective as possible for the future. I think everyone would agree that one of the things that drove this development of digital interventions was COVID. So I'm curious what your opinions on how COVID kind of shaped the current state and the trajectory of digital interventions.
Right, right. Yeah. So I definitely think, the common misconception is that, oh, okay, it was like COVID that sort of led to the creation. I have to say there were digital interventions, or at least initially being tested prior to COVID. I think COVID was just really the catalyst that made people realize that hey, what's going to happen if something like this ever happens again when everything shuts down. But then of course other things that came to mind that, once digital interventions were introduced during COVID or started being tested, with more force, with so many more studies being done. Of course, things like accessibility, cost, those things came more to mind. But also, like I said, COVID was sort of the catalyst. People realized the importance of having sort of alternative options to in-person therapies when in-person therapies are not available. At the end of the day, I think blessing in disguise, unfortunate that COVID had to happen, but blessing in disguise that at least this realization came into the field. And then I think any resistance that was present even within clinicians or researchers about digital mental health, I think those things have been sort of there's a more nuanced or subtle view present where it's like, okay, this can be used actually to treat patients, or people started seeing, even researchers started seeing more value in these interventions, and I think that's really beautiful at the end of the day.
So beyond that, in the spirit of technological developments, etc., another trend that I have to hit here is AI.
Mhm.
So I also want to know what role do you think AI plays in digital interventions, how researchers, clinicians can really put this new tool to use?
Yeah, for sure. Yeah, I think AI is a tricky one only because of the fact that there's a lot that's still being tried and tested, and it's sort of, to some level, there's artificial autonomy that's present, and oftentimes, I'm not saying all, but oftentimes there's very little therapist kind of interaction, and it's more of just the AI that's trained to do the work that's doing the work. And so there's a lot of sort of tension in all fields, but also similarly in mental health regarding AI. I think it's, in terms of research itself, AI is being used in a lot of different ways, in sort of tailoring treatments, not necessarily delivering interventions, tailoring treatments, sort of finding better fits. I think in terms of research, like doing literature reviews and conducting research as well, to a certain extent, it's being used massively. In terms of actual interventions, though, I think that's where it gets tricky, and then where there's more tension. I think regardless of the two sides of the debate, that whether it should be used or where it shouldn't be used, I think the most important thing, and this is mainly to respect and to make sure that to respect patients and to make sure that they're safe. I think it's important that these AI tools that are used for interventions, usually chatbots and AI agents and things like that, that they be sort of trained to precision, because we cannot have mess ups in that sense, right? I think there's even more, not only stigma, but there's more responsibility for AI not to mess up compared to, say, a therapist, like a person messing up. I think to some level that's still acceptable by society, but I think if an AI agent sort of or a chatbot like messes up, I think that's at least to most people that seems to have a greater impact in their minds. So I think it needs to be, these models need to be, or these algorithms need to be trained to precision to make sure that the therapy that they're delivering is effective and is going to protect the patient's rights and autonomy. And I think that's important to remember. With that said, in terms of more optimistic light, I think there are sort of interventions being tested using AI, particularly sort of chatbots. I think that's the first step that's being explored. And so I hope to see something that's sort of trained well into precision by computer scientists and researchers alike.
An example that I want to use is in the spirit of the Aura Ring example that
Mhm.
you brought up at the beginning of the
Right.
recording. And then I know you've done some work regarding an app with physical markers for sarcopenia. Could you tell us a bit about? I feel like AI might have been used in those kind of projects just because you have so much biomarker type of data that an AI would be so useful to sift through all of that. Am I correct there?
Absolutely, absolutely. I think AI is really effective in that sense, more than even kind of delivering the intervention. I think it's so effective in sort of going through data quickly and sort of highlighting what's important, what's not important, or at least being used not as a solution, but as a tool for, individuals. And so, yeah, let's kind of delve into these two things a little bit. Yes, there was an app that friends and I were sort of working on or thinking of working on. Unfortunately, it did not kind of reach to fruition, but it's something that we did in our first year of masters. It was something that we sort of pitched in one of those app or digital mental health competitions, and it was or not a mental health but digital sort of health competitions. It was an app for sarcopenia. So sarcopenia is essentially this condition is very prevalent in older adults. As people age, they seem to a lot of people seem to lose muscle mass, function, strength, that sort of thing. And so, as you can imagine, very common. But what happens is it often leads to a lot of physician burden, or it's not actually being addressed as much, right? I think this is something, not to place conditions over other conditions, but this is something that doesn't necessarily need a lot of physician intervention. If there's sort of an app that's available that can be used to target this condition, I think there's a lot that individuals could do, virtually or through an app like that. So essentially, one of my friends, he's into machine learning, and so he codes a lot. And essentially, yeah, he made this sort of app that we were just trying out to see how it would look like or work. Essentially, it would have sort of like a chatbot. That was sort of the focus or the difference from what has been done in the past. So of course there's websites or apps that have, recipes for what food or what diets are good, or exercises, what exercises are good for people who have sarcopenia. But the difference was not everything, it's very important for personalized interventions. I think this is where digital mental health and AI plays a huge role. And so what the focus of this app was more personalized interventions. Say someone has sarcopenia, but they also have an injury, right, in the leg. And so there are certain exercises that they're not able to do. What to do when situations like that arise, right? And so the goal here was for this AI chatbot to sort of tailor exercises, keeping individual factors in mind. Another factor was diets, for example. A person in the West or who's born and brought up here with sort of, let's say, European origins, they eat very different food from a South Asian person, right? An immigrant South Asian person. So the goal was to sort of even tailor diets and food habits. There's people who eat non-vegetarian, those who eat just vegetarian. So it's like tailoring food habits, diets to these specific, characteristics of individuals. And I think that was the most powerful thing about the app. Hopefully, fingers crossed, we get working on that someday in the future. So that's one thing. This other study on the Aura Ring, right? So that's something we were also planning to have as part of the app, sort of getting moment to moment sort of measures in things like heart rate, temperature, general activity throughout the day, things like that. But speaking more about this other study that's being used in addictions, this Aura study is being used in addictions. Essentially, they've collected about data on around, I want to say, 70 to 80 individuals, essentially, taking into account all of these physiological measures. What we want to look at particularly, at least in my lab, is if differences in things like heart rate, variability, or temperature, or even activity, it's related to substance use or craving, right? So what's the sort of correlation between these things? Is it related to, it can also arguably be used as an intervention. Does using this and people being more engaged on the app, does that lead to them becoming more aware, that they have substance addiction and that they need sort of more treatment, more intervention? They need to be more, engaged in their treatment and to sustain their treatment. Does it lead to these sort of outcomes? And so arguably, while it's only right now being used more to sort of measures these, to gain these physiological measures, can it also be used as an intervention, right? So kind of shifting thoughts in that way.
So, with how popular and how much development has happened in this space, this
Mhm.
also has, I'm sure, led to a lot of skepticism. What would you say to the
Mhm.
people who are not quite convinced about the benefits of digital interventions in mental health?
Yeah, for sure. Yeah, I think with anything with anything new that comes about, especially in a field that has been, of course, it has evolved, science has evolved, but at least people's minds sometimes they can be rigid, right? I think there's a lot of tension. Um, I think initially it's getting better now, but there's a lot of resistance to AI and digital interventions initially. I think it's getting better. To those who are still sort of resistant, I think it's totally fair for them to be skeptical of this. But I think the best thing you can do is really read into the facts, read into the literature, and see actually what these interventions are being used for. Sometimes, I have to be honest. I have seen, unfortunate stories of cases where digital interventions or AI has been used and it has led to negative consequences in people's lives, right? But I think it also comes with AI or digital health intervention dependence. I think the dependence is a key factor. And that's why I even mentioned earlier that these until these things are trained to precision or they're sort of perfected to a certain extent, I think it's important to remember how dependent you are, but also how you use it. So, do you use it more as a starting point? Are you constantly reliant on it? I think the best approach more generally would be to use it more as a starting point or more as a tool rather than being completely dependent on it and to do everything that it says or to keep using, right? To keep using the digital interventions. I think it's important to move out of that, use that right as a tool, and then try to get better in more naturalistic ways as well, or simultaneously.
Right. So I'm gonna wrap up here. Normally, I end off episodes by asking about one piece of advice for our particular sub audience for that episode. I'm gonna change it a bit today. So I
Mhm.
just want to ask of everything we talked about, one digital mental health intervention that you are particularly excited about, and what makes this particular one stand out.
Yeah, it's a very interesting question. I yeah, so this is something I've been looking into. Essentially, it's sort of an app for craving in addictions. Um, what it would do is there's something called ecological momentary assessment. I think I spoke about this earlier in the episode, but it takes sort of moment to moment responses. So during the day, people would be sent a survey through an app or through text, and then they sort of respond to the survey multiple times a day. And then plus, there would be sort of, say an aura ring or something like that involved, which takes physiological measures. Whenever there seem to be spikes in craving, either through the measures that ask them if they're craving or they're using substances or increase in heart rate or physiological measures of likelihood of sort of engaging in substance use, it would sort of send just in time adaptive interventions. So they call GITAI and through a sort of app. And that kind of it's all digitized, so it would be sort of a recommendation of what to do in that moment when they're feeling a sort of sense of craving, about what to do about that craving, how they can sort of either distract themselves or you know um, reduce substance use if they do end up consuming. And so I think these just in time adaptive interventions they really fascinate me. In addition to the all the VR stuff as well.
I'm excited to see all the development in that space. Shannon, thank you so much for taking the time to do this with me. I think that was a great big piece of content. I'm happy we got to share a bit about the work that's being done in the space.
For sure, for sure.
All
Thanks
right.
for having me, Ben.
Thanks so much. Take care. Bye. Thank you for joining me for today's discussion with Shannen Kyte. If you're enjoying the Wellness Lab, please subscribe on YouTube or Spotify. You can also follow the Wellness Lab on Instagram for updates and information about new episodes. Link is in the description. Lastly, if you know someone who you think might benefit from listening to this podcast, please share it with them. Thank you for listening, and I hope you join us next time.